Hi, guys. Welcome to Threads Podcast. Hi, gals. Hi, guys. Welcome to Threads Podcast, Life Unfiltered. You are in store for a topical episode with Ben and Jason. Super excited about that. This is just kind of something, us changing it up. We're going to try it. We tried our wives, and it went okay, but scheduling was a nightmare for that.
It absolutely is.
Yeah. So we're going to try this, or not try it. We're going to continue our topical series and see how it goes.
Yeah. So on this episode of the Threads Podcast, Life Unfiltered, we are talking about doctor-assisted suicide.
Ew.
Now, this is something that exists in our world, and especially out west, it's a real big thing.
Is it?
In Oregon? Oh, yeah. Like, there are, if you're in the hospital, they'll present you with that option at some hospitals.
And it's legal?
Yes.
Oh.
In some places, it is. And there are manufacturers who also produce chambers, essentially, for the sole purpose of ending your life.
Wow.
Yeah. So like blow some toxic gas.
Yeah, and you go to sleep.
Yeah. And you can position it wherever you want it. So people have talked about how when they go, they want to be on a mountain. So they're going to have this chamber set up on a mountain. And it's just so weird to me.
Yeah, I'm surprised you traveled to I hate this. Oregon, being so liberal out there.
It is. It was. Yeah. I remember on my first trip out there, the pastor at the church that was looking at hiring me took us to the coast, and there were protesters on one of the streets. I'll never forget it. One of the guy's signs said, "Who would Jesus bomb?" I was like, what?
What does that even mean?
I don't know, but it was a super liberal protest, and I was like, well, that's strange. And he's like, oh, no, that's Oregon. People protest here all the time.
It's their right to.
Yeah, they do. So I don't know how I feel about this whole topic of doctor-assisted suicide. It's definitely it feels dark. Maybe I don't know if it should, but I just kind of get a dark, creepy feeling about it.
In general, I agree with you. There's a creep factor.
Yeah.
It's above 5 on a scale 1 to 10. It's probably like an 8.
Yeah.
It's definitely up there. I think why we feel creepy is because someone's playing God.
Essentially.
Yeah.
They're determining when they die.
Right.
And I don't know how I feel about that.
Yeah, one of the questions, we have a list of questions that we're just going to kind of go over and just kind of give our opinion on it. And one of the questions is, should this practice be legal? And clearly it's legal in Oregon.
I believe it is. I don't know for 100% fact. I just know it's...
Why didn't we fact check this?
Seriously.
I'll do it. Are we racing? Assisted suicide. I can't spell. You're going to beat me.
It is.
Okay.
Since 1997. But
No,
you have to be terminally ill.
Okay, and it doesn't matter how terminally, like, that's a dumb question, but I mean, like, if just a doctor says that you're terminally ill.
Yes, you would have to have a doctor sign off on it. A terminal diagnosis with a 6-month prognosis. And you need that to be confirmed by 2 licensed physicians.
Okay.
So it's legal, yes, but they need doctors to either perform the procedure, such a weird word,
Yeah.
or to prescribe the lethal medications. And that's where those chambers come in.
Okay. Yeah, I think I'm okay with it being legal if it's voted in that's what the people do. It's like marijuana.
Yeah.
You know, I'm for it, but there's people that aren't. But the voters spoke,
Yeah.
and that's what happened. Doesn't
Yeah.
mean you have to participate, but this is just the reality we live in.
I think so. And the law needs to be blind. And what I mean by that is it can't favor one side over the other.
Right.
So, though, for example, I myself, I don't know that I would go out on a soapbox and say I am for gay marriage. But I still feel like, regardless of how I feel about it, it should be their right and their opportunity to, to have the same rights as I do as a married straight man. Who's to say that a married gay couple shouldn't also have those benefits? So, though I may not be a fan of doctor-assisted suicide, and though it creeps me out and gives me the heebie-jeebies, yeah, I do think it should be legal. If that's what the people are wanting.
So you're saying you would vote for it?
See, that's the thing.
You just said I think it should be legal. That means you would vote for it.
Well,
you're okay with it being legal, but
I'm okay with it being legal. Perhaps it should. I'm not. I guess putting that "should" in there is where
that's where it turns. Yeah.
Should it be legal? I don't know. I wouldn't vote to make it legal. But as you're saying, if that's the vote of the people, and the government is supposed to be representative of the people, then yeah. Would I vote for it? Probably not.
Okay.
But everybody else would.
Yeah, I would vote for it.
Interesting.
Yeah, I feel like if you want to go, you can. Like, that should be your right. I know it's not the most popular thing, and it's uncomfortable to think about, but I think especially with my father-in-law that had pancreatic cancer.
Oh, sure.
That was shitty. It was horrible. I mean, he basically got diagnosed in July and was dead by Thanksgiving.
Wow.
I mean...
Was he ever in hospice?
Oh, yeah.
Okay.
Yeah.
That's another thing, too, because I think if you're not careful, hospice can become a very skirted assisted suicide.
It is a very, very gray area.
Yeah, because I know for a fact that they give high doses of morphine and things like that.
Especially towards the end.
Yeah.
I mean, they basically put you on a different planet.
And they can basically tell you when that person's going to pass.
Pretty close to within like an hour.
Yeah. So it's like, that's pretty on the edge of assisted suicide right there, but okay.
It's so hard to... What person is going to fight against a hospice nurse about giving too much morphine?
Right.
Like... Nobody.
Yeah. Exactly.
I mean, maybe a crazy family member that wants this, like, has this weird delusion that this person's going to survive this cancer.
Yeah.
But
there are delusional people out there. Like, I'm sure you've heard the stories of kids who are in a vegetative state, and yet their parents insist on keeping them on life support.
That's bizarre to me. Like Megan and I Megan and I have it in our trust. Like, we have specific things. Like, if it goes, I don't know what it is exactly, but I think there's like a time limit. If it goes like 30 days, like, we out.
Yeah.
Like, let's just do this. I'm going to go to heaven anyways. Exactly. So it's like, you can just pull the plug.
Yeah. So, well, we kind of jumped into this already, but what are the criteria you think that should be required? We talked about doctors signing off in terminal illness already. What about, well, this jumps into the next question, but that's okay.
Who cares?
What about mental health conditions? Somebody who was so fractured mentally, should they have the same right to doctor-assisted suicide, even if there's not a physical component?
I think it all depends on the mental capacity. Like, if you've been diagnosed with, there has to be some bullet points. Like, diagnosed with schizophrenia? Nope. But what if you're terminal, though, and you have schizophrenia?
Yeah,
like,
that's true. I don't know.
I mean, there's a lot of things that are involved, like if you have a caretaker, like there's so many different gray areas.
Yeah.
On what could be considered mental health. I mean, I'm on a medication. Do I get the right to choose assisted suicide?
Yeah. I mean, that's a really good thought. So what other criteria should be required for that to happen? Like, you mentioned the medicine. So are you saying that because you're on a medicine that regulates mental health, should that be a factor in determining yes or no to the...
I don't think it should. Yeah. But, to be in the military, if you are on, like, antidepressants, like, you cannot be in the military.
Yeah, which is kind of interesting.
Yeah.
And that's one thing that I know it's not going to happen, but this draft that I keep hearing
Why did you even bring it up? You're just continuing the stupid hype about it.
It's true, but there would be no chance of it happening because so many of the millennials are on antidepressants and things like that. So,
yeah. I definitely think, I don't know. I mean, in my head, my logical brain says I do need a doctor to sign off on it, but in my like liberal side, I'm like, no.
Do what you want.
Do what you want. I mean, it's your life. I mean, it's weird. It's against the law to commit suicide.
Yeah.
Like if you try to kill yourself and don't succeed, you can be criminally charged.
Really?
Yes.
I don't know if I don't like that.
It's dumb.
That is very dumb. I mean, the person's obviously struggling.
I don't think anyone ever is. They obviously get the mental health, but I mean, I think it's there, and I don't know what the reason is. Probably an old law, but don't you feel that if you don't need a doctor to sign off, like obviously you would know you're terminally ill, the doctor, but what if the doctor said, I'm not going to do that?
I don't know.
I'm not going to sign off on it, but you're going to die in 6 months.
Yeah. See, I don't know if I would even seek it out. Like, if I was terminally ill, I don't know. I feel like God would take me when it was time.
Right, and it's hard. Yeah, so that's interesting you brought up the God part. That's the weird part.
Yeah.
Take the legality out of it. Take the weirdness out of it. If you're a faith-based person and you kill yourself, here's another tangent.
Oh, yeah.
Do you go to heaven or hell?
I don't think it matters. I don't think that's the deciding factor of suicide.
No. But if you're a believer, you believe in Jesus.
Yeah, so you believe and then you commit suicide, you go to heaven.
Really?
100%. 100%.
100%?
Absolutely. I am so sure of that. I mean, as sure as we humanly can be.
Sure in the human form.
But I know of pastors who have committed suicide. Do I think that God sent them to hell because of that one choice? No. I mean, God doesn't send anybody to hell based on one choice.
Well,
except the choice of accepting him as savior or not. That's it.
You're right. And so if he views suicide and infidelity as the sin, like they always say, like every sin is the same in God's eye, then you are 100% right. Yeah. They go to heaven.
Absolutely. I don't think there's any doubt. There's no doubt in my mind.
What about babies?
They go to heaven.
Yeah?
I think so. We're getting off on a couple different tangents.
Well, this is a big one because I think you're right, and I think God can individually say, well, he has not had an opportunity to accept Jesus Christ. It hasn't been presented to him.
It's all about the age of accountability is what they call it. And, I don't know if God has a set numeric age.
No.
I think for each kid, it's different.
Well, if he created us, he can do each person.
And he knows. Exactly.
Which is weird. Stop flipping those papers. I'm hearing them.
Sorry. Jeez.
I need to get Ben a fidget spinner that doesn't that doesn't make the noise.
No kidding.
Yeah, we got off on a tangent there.
That's okay.
Yeah, it's okay. It's still something to talk about. So I'm glad we brought that up about that because I always worry, like, when someone kills themselves, it's like, oh, man. I mean, but that's a good point. If you already gave your life to Christ and a sin is a sin.
Yeah. Do I think God favors suicide? Absolutely not.
No.
And that's why I really struggle with this whole idea of, doctor-assisted suicide. It's essentially, I think it goes against God's plan for us. I think God makes it clear in his word that there's a day to be born and there's a day to die, and those days are determined by him. I really struggle personally with this idea. I don't think I'm for doctor-assisted suicide, but I am for people having the right to choose if that's what they want to do. So,
yeah, I mean, the plan thing, that's weird to me because everything happens for a reason and a plan, right? So us recording now is for that. What if I dumped that soda on the board? Was that part of God's plan, or is that the devil?
I think regardless of what happens, God can use it.
Yeah, so why can't he use the assisted suicide?
I mean, he could, but I don't think it's his original idea.
No, I'm not saying that it is either. But
somebody keeps blowing up my phone and it's vibrating on my wrist.
How does that feel?
Don't like
Keep your hands above on the desk, please. Well, I don't know. we can go around and round about God's plan, but I think if that, I don't know. I just don't. I think that is part of his plan. Because why else would it happen then? If he's planned out your life, yes, there's sin, but isn't it technically still his plan? I don't know.
Good question.
I don't know.
It's
so frustrating.
It is.
That's
There's so
why
many things that I would like to ask him when I get up there.
That's why I struggle with faith. And because I'm a skeptical guy, but I do believe in Jesus. But sometimes I'm like, okay, this is weird.
Yeah.
Am I supposed to? I would struggle if someone came in and said, "I'm going to blow your brains out," but you have to denounce Jesus Christ. I hate saying that, but isn't that bad?
I don't know if it's bad. It's reflective of our culture and our world.
And I'm not going to say what I would do because I don't have a gun to my head. I'm
right.
not in that. You can't ever some of those things you cannot do hypothetical.
Exactly.
I hope I would do the right thing, but I'm also a human being.
Yeah.
And again, is that God's plan?
Yeah.
If I decide to denounce Jesus Christ, is that God's plan?
That was your plan, but God can still intervene. I think the word I'm looking for is God is sovereign, which but it does tie in with what we're talking about.
It does?
I think
we're
so.
going off the bandwagon.
Sovereign. Well, if God is sovereign, then
I don't even know what that means. Thank you. So you're going to have to give me a wiki on that.
I'm working on it. Sovereign God. Sovereignty is the Christian teaching that God is the supreme authority and all things are under his control. So if you believe that God is totally sovereign, then you believe that everything that happens only happens because it was ordained or put into motion by him.
Okay then. So if you kill yourself, then that was put into motion by him, right? Is that basically what that says? Or guess. He's chosen not to intervene?
Yeah. I mean, but then you could say that it was God's idea for the Twin Towers to be blown up.
Yeah. And then that's why people struggle with faith, because they say, how would your God allow all those people to die and suffer?
Yep.
And then everyone in the religious says, well, there's sin, the devil. And I'm like, okay, but if God is sovereign and he controls everything, it's like this weird double-edged sword. Yes, he controls everything. He's all being and amazing. But, oh, by the way, the devil's over here, and we're just going to let him do his thing.
Yeah.
And we're not going to step in to save it. It's weird.
It is very weird.
That's where I struggle sometimes in my faith.
Well, here's an article I just found. If God is sovereign, did God create evil? My husband and I have been through trials we never thought we'd go through, but we can walk in peace because we know that God is sovereign. And this God that sits on the throne, that creates good, that creates adversity, he is love. So
it's not helpful.
Basically saying, yeah, God is sovereign. He created the hardships just as much as he created the good times. So,
see, I always looked at it like he's because of sin, he's allowed the devil to do things, but he doesn't ever let him, because clearly he doesn't ever let him get full control.
Yeah,
because we'd be dead.
Exactly.
We'd all be dead. This has still been going on. We're still making, is there pain and sorrow and suffering? Yeah, but I don't know. We need to get a pastor in here, like a legit practicing pastor.
Yes, not a former.
And that's nothing against you, but you're not in the Word every day. Well, you may be, but not studying.
Not to that level of studying.
Right.
No. So this is interesting, too. This, again, ties in.
No, it doesn't.
It does.
We have to relabel this episode.
We'll call it doctor-assisted suicide. And
is God real?
Sovereignty.
God's sovereignty.
Just as peasants always bowed before their king for fear of offending the one who had the authority to take their life, God's sovereignty compels us to bow before him. But unlike earthly kings who abuse their power to terrorize their subjects, God rules in love. He loves you and wants the best for you. So it's saying that God's sovereignty calls for our submission. I don't know. How do you feel about that?
Yeah, I believe that, but it still doesn't answer my question of why the people died in the Twin Towers.
Because God's sovereign and he knows what he's doing, is what people would say.
But that's tough.
God's sovereignty.
Do you understand why people that don't believe in faith, how it's hard for them to swallow that?
Yeah, absolutely. I wish I had a better answer. I wish there was an alternative to God's sovereignty.
And there isn't.
It's just
even having a pastor in here, he doesn't have the answer either,
No.
but he may be able to explain it a little bit better.
Yeah.
So
It's ridiculous though, because I would just love to be able to explain away the hard things and say, "Oh, but that happened because that."
Oh, the silver lining, you mean?
Yeah, I'm all about the silver lining. But there's not a silver lining all the time.
Right.
Actually, but here's the thing though, isn't there? Like, can't God bring a silver lining out of a tough situation?
I think that's the whole point. Like the whole point by someone suffering is somewhere out there
Go ahead.
will be affected positively by this suffering. Because I can't believe God would be like, yeah, you're just going to suffer. Peace. Like, this is just what you are.
Yeah.
And it just, I think the suffering would be a lot easier if people would be able to be like, oh, I know my suffering is going to help such and such or this person.
Yeah. Interesting.
I mean, that's kind of what Jesus did. He knew it was going to save the world, so he went and suffered for other people.
I think the trouble with silver lining comes in when you skip over the pain and just immediately jump to the silver lining.
Don't sit in the pain.
Yeah, like Jesus hung on the cross and he cried out to his Father and said, "Why did you forsake me?"
Yeah.
Like, how could you just leave me here? And I think that's where my issue comes in. I don't like to feel the pain. I don't like to feel those things. And I think it really comes down to the fact that I would rather God not be sovereign and just pretend the pain's not there and just silver line everything.
That'd be great.
So,
can we get back on topic for this? I don't know if we can. We might have to.
I think we can.
Okay.
I mean, honestly, this is really ties it all in, because how do you think God feels about doctor-assisted suicide? I think we just.
And what about the doctor?
Yeah.
Like, what about his life? What about his faith? If they
no kidding.
believe in God, like,
I haven't even thought of it from that perspective.
Right. Can you be a doctor that does that? And now it's not legal in Michigan, right?
It is not.
We had Dr. Jack Kevorkian.
Yes.
That was like a huge deal back in the late 90s?
Yeah, he was on 60 Minutes. I remember watching it in school.
Yeah, and I was like, you know what? Let him do it. He's doing them a service. He's taking pain away from them. Mm-hmm. And I still go back to that. That's why I would vote for it. And I think until we're in that situation, like Megan saw her dad, like I saw him like 2 weeks before he passed. She saw him pass.
Yeah.
And to watch that person suffer, we can't experience, it's hard to empathize with it because you haven't experienced it.
Exactly. And the closest thing that I've experienced was a similar situation. It was my grandmother. She was on her deathbed. Like literally it was going to be hours. And I just remember she was making like the dry heaving breath sounds that happen when you're about
shallow.
to die. Yeah. And just crazy. It was so weird. I've never seen anything like that. But we were reading scripture to her, some of her favorite verses that were underlined in her Bible. And even as she's dying, like you could tell she was hearing the words and that they meant something to her. But yeah, she was hopped up on drugs. I know that she was. She was on morphine and everything else. She barely was there. So it's like, if I'm okay with that, then why wouldn't I be okay with doctor-assisted suicide?
Right. Because I think what it is it's a practice that's not approved by the government, whatever I almost said FCC or the FDA or the medical, whatever the hell it is.
Yeah.
And it's just, it's uncomfortable.
It is.
And no one wants to talk about it.
Yeah. And that's why we talk about it, because we're Threads, Life Unfiltered.
That's right. My question, back to your grandmother.
Mm-hmm.
Grandmother?
Yes.
Was she sick? Like had cancer?
No, primarily she was just old and her body was running down.
That's interesting.
She had diabetes and she had, I think she caught pneumonia. Like there were definitely physical illness factors, but a lot of it honestly was just old age.
Yeah, it's interesting that they had her on a bunch of morphine, because I also watched my grandmother take her last breath. And I will never forget that.
Oh, yeah.
It's messed up.
Yeah.
And I don't remember them. I don't think they had her. I don't think she was on hospice. She was living in an assisted living home. Like, she wasn't even in the hospital when she passed. She was in the home. Like, they knew that, she had just slowed down really quick. And maybe she was on meds, but if you've never experienced that, that's rough.
It is.
It's rough.
It was because that's not how I experienced my grandma, and even weeks before that.
What's really weird is when you think they pass and they take one more big breath and it scares the shit out of you.
Yes.
And you're like, Grandma T, what the hell? That's what I said.
And then they'll have sometimes they'll jerk as the body's shutting off.
Yeah.
It's
weird.
Stuff.
Yeah.
Yeah.
So back to the doc.
Yeah.
So what do you think about that?
If I was I would have a really hard time with it, to be honest.
Do you think a person of faith can be an assisted suicide doctor? I honestly don't think so.
I don't think they can. I don't know.
I mean, you can legally, but I mean,
maybe a liberal Christian who saw no issues with it. But for me personally, as one who kind of hugs the fence, I'm not really on one side or the other. I would really have a hard time with it still.
Me too.
Like, I would probably go ahead and inject the medicine because that was my job. But I'd have to go to therapy afterwards. And
well, let's hope they do anyways. Although if taking the faith part out of it, if you do that, you're not a sick person. You believe you're really helping them. And I think you are.
Yeah.
You're taking the pain away.
Exactly.
And they don't want to live anymore. It's not like you're putting a gun in their mouth and like helping them squeeze the trigger.
That's true.
I don't know.
So any other criteria that you think should be present?
I mean, I definitely think you should be terminal.
Yes.
And
what's terminal? I mean, is it 6 months left to live, or
6 months is a stretch where I think stuff could get pulled out.
Yeah.
I mean, because I feel like if you give it too long, people are just like, I'm going to give up. And I guess that's their right. But I feel like in 6 months or a year, like if maybe something would come out, like maybe all of a sudden you get a call the next day like, hey, we got this experimental drug.
Yeah.
Do you want to try it?
Yeah. I mean,
I don't know.
Going back to the doctor, how awful would you feel if you just help somebody end their life and then the next week there's a new trial drug that comes out that could have saved them?
Well, I think it all boils down to the comfort level of the patient.
Yes.
Even if it's you have possible 6 months to live, but your quality of life is garbage.
Yeah.
Who cares?
Yeah.
Like, do you want to live 6 months in garbage?
I know.
But I'm always the one like, something might work.
Yeah. It would be really hard for me to get to a point where I said, okay, I'm done. Because there's always that hope, that optimism that perhaps something good is around the corner.
But again, we cannot empathize because we've never been terminally ill. Thank God.
No kidding.
I'm terrified of cancer.
Oh, yeah.
I mean, do I eat healthy? I try. Do I move my body? I try. I could do a lot more.
You still box?
I'm not. Megan's about ready to kick my ass because
Sorry, is that a touchy subject?
No, it's not. She's been very graceful with it, and it's just so. I'm making excuses. I have been, but not as much, and I need to.
Yeah.
There's your answer.
Nice. Can I go off on a little rabbit trail?
Yeah.
What time are we at anyway?
We're at 28 minutes.
That's perfect.
Yeah.
So, boxing. I had offered up my heavy bag to Jason. He didn't want it. So I was like, okay, whatever. So I put it up on the Northview buy nothing page. It's like people
free.
Yeah, it's
free.
It's a free stuff.
Yeah.
And of course, the person who claimed it, this is kind of going full circle with episodes we've done of Threads, was the mom of a transgender student at Northview. And a kid that had played soccer. I knew them when they were a she, and I now know him as a him.
Yeah.
And I don't know, like, it's like Threads has brought that issue to the forefront. And like, I've had several people in my life, and in your life too, that have come to us and had acknowledged the fact that they were transgender. And it's just, so I think with this topic of doctor-assisted suicide, now that we've brought it out into the open and talked about it. I'm curious to see if there will be a similar type of thing that happens.
Yeah, I have not heard or seen anything about this since like Dr. Jack. So like us talking about it is people might listen to this episode like, who even talks about assisted suicide? But clearly it still goes on in other states.
It does. It's a big deal out west.
I wonder if it'll ever be a hot button issue. You know, the hot button issues, you know, every 3 months things rotate through, but I haven't heard anything about it.
I think it's just one of those things that flies under the radar.
Yeah.
Similar to hospice. Hospice, they're essentially keeping you comfortable till you die.
Yeah.
And offering a lot of drugs towards the end of your life. I think this just happens kind of under the radar.
We should have looked for a hospice nurse to bring in here to talk about this because they would have a totally different perspective.
Oh, man, they would.
Doesn't mean we can't do it. Any hospice nurses out there?
All right. You want to come chat about this?
Please, thank you for doing what you're doing because that is a rough job.
No kidding. I mean, just working with patients until they die and then you start with a new one.
It's not like a mortician where they're already dead. Like you're seeing these people in two different lights and it's, gosh, I could never do it. So thank you for doing what you do.
And so I feel like I did with the whole transgender issue. We talked about that news story. And for me, it was very much just an issue. It wasn't like a person thing. So I feel like I'm in the same boat when it comes to doctor-assisted suicide. I've never had anybody in my life that I can even think of that this was an issue that they wrestled with. So it's hard for me to, get an understanding of the person aspects of it. And so I'm very much issue focused with this one.
Yeah, that's a good thing that you put out. And I bet through this podcast, you've opened your eyes. And even with me, I still don't quite get it, the transgender thing, but I respect it and I understand the struggle that they go through, especially since I've talked to people and it's not some bullshit thing. Like this is legit.
Yeah.
Like if anyone that thinks that it's just, they're just like, bah, 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 bah.
Yeah.
It's not like that.
It's not like this kid, he has come so far since having his top surgery and since really identifying as he. And again, it all plays back to this whole issue of God's sovereignty. God knew that was going to happen.
Right. So how am I to judge what God has made?
Yeah, I mean, if things happen, God has already known about it. So
yeah, bringing it back to the Twin Towers, like it happened and you can be angry and sad about it, but it's still part of the plan. And it's just hard to accept some of the things that are part of the plan.
Yeah, it is. It definitely is. And then, of course, it begs the question, you mentioned the devil. Like, is there like a second option? Like, is it the devil? Like when bad things happen, can you just say, that was the devil? Or do you say that it's just part of God's plan?
Well, I think people do both of those.
Yeah.
I think they say that's the devil to protect their God.
Yeah.
And not say that's part of the plan. That because how douchey does it sound? Like when someone, like even Marcy brought that up. Like when people would say that
part of God's plan.
At the funeral home.
God knows what he's doing.
And you're like, I'm going to beat the shit out of you right now. You better shut your mouth.
No kidding. Man.
Well, thank you guys for listening to this. We hope you like them. I know we did get a little feedback on the last one, which was probably back in December.
Yeah, I think
maybe.
So.
Reach out to us. Let us know what you think about doctor-assisted suicide, if that's something that you don't care about, or maybe you have a perspective that we didn't bring up.
Yeah, for sure. Let us know. This is definitely something I'm curious to hear more about.
Yeah, we should like somehow be able to like in 6 months say, did you have anything come up like that maybe you missed? And you're like, oh yeah, there was. Well, of course there's going to be something on our Facebook feed. I mean, some sponsor, I guarantee there's a hospice sponsor on Facebook.
Yes.
So guys, check us out online, threadspodcast.com. You can get some merch there. We had a few people buy merch over the winter, which was super cool.
I need to get some.
I know, I do too. I just don't want to pay full price for it, and it's kind of cheap that way. But of course, check us out on Facebook, Instagram, Twitter, and download the podcast. So if you're listening to this, I guess you already downloaded, so I'm an idiot. So, all right, have a good one.
We'll see you.